So tell us what's new in managing the diabetic foot ulcer, or just ulcers in general, wound problem that we see particularly in the foot.
Okay. Well, I think we'll start with the basics. You know, I always tell my patients neuropathy is the root of all evil, which comes from elevated sugar. So we got to keep our sugar under control to prevent the neuropathy. After you get neuropathy, you develop calluses. And this is where we were talking a little bit earlier about how some of the calluses can become open wounds. Then once these calluses...
Particularly a tender callus, because you're going to have a wound underneath of a thick callus.
Right, and then the big problem, what I kind of try to educate my patients with is if you have a callus, we need to see you at least twice a year, at a minimum. And then I educate them on looking for little blood dots inside the callus. That means that there's like injury to the tissue. And that's when we really start seeing them frequently, because if we start seeing them more frequently, some patients I'll see every 4 weeks, some I'll see every 2 months, based on their callus formation to prevent them from developing an ulcer. Because if they develop an ulcer, then it becomes a pretty significant deal, and if that ulcer gets infected, you're 120 times more likely to have an amputation. So I think it's really important to do the preventative stuff and with education. Some of the new things we're looking at, we talk about circulation. One of the new things we're looking at is I just actually been playing with this little device here, and this actually looks at oxygen content in the skin. And you can see there's
looks like my fish finder there.
Yes. And you can see right over in this area here, there's some bluish parts over here, and it actually kind of tells you how much oxygen is in the tissue. So I've been using this device so that my patients, I'm like, hey, see, red is good, blue is bad, so it's allowing them to really visualize how their circulation and their oxygen content is in the skin.
You place this over a foot, and it gives you a blood flow mapping. So
right, this is a camera.
Okay, so that's a thermal camera.
Right.
Right, and so as you hold that over parts of the foot, this image shows up to you, and it's color-coded so that the areas of red are good.
And the blue is bad.
So if you see a corner of the forefoot or a side of a heel that has bad blood flow, this thermal camera will be wonderful in telling you really what the story is.
Right, and they've actually done studies where they've used it for showing that hyperbaric oxygen, which our local wound care center has, that shows that they can increase the oxygen level at the skin there, and then the wounds can continue to heal. So that's like but I think patients too like pictures. They really like to have a picture of thing. The other thing we got that we've just kind of been playing with here, because I like toys, my staff is always like, oh, you got another gadget, you're coming in. Now this is a pretty neat device too. This is looking at bacteria, Mark. So it regulates a 10 to the 4th bacteria, which is an infection. So I don't know if you can really zoom in on this at all.
So 10 to the 4th bacteria is
more concerning for an infection.
So it's a great number of bacteria. So we all have bacteria on our skin, but if we have 10 to the 4th power, that's a tremendous number of bacteria, and so that they give us off a certain wavelength of energy that this picks up.
Correct, and it also tells me what kind of bacteria. So this camera tells me if it's green, it's a certain bacteria, I know how to treat it. And you can see here, that has that little bit of red on there. You can kind of see the red up there in the corner, and that's telling me that there's a different type of bacteria. So I know how to treat the patient, what antibiotic to give them.
And save a trip to the operating room.
And save a trip to the operating room. And I can go in there with like a scalpel or a sharp instrument and clean that bacteria off there before they even leave it, and I get rid of that bacteria and able to do that.
That's phenomenal.
So
that's
it's really been
phenomenal.
So these are some great little toys that we've been playing with. We also been getting into grafting and stem cell research in some of these patients where we're using amniotic grafts, which are grafts from a female that had a C-section. You know, the amniotic sac that goes around the baby is processed. It has lots of good nutrients, growth factors to help these wounds heal.
We talked about that a couple of weeks ago with Dr. Martin, who was phenomenal. And those who saw that show we really emphasized that in a very safe way you can stimulate the healing by adding, stem cells or stem cell derived products.
Growth factors, and then the other another thing we've just introduced in our office this year is something called Ultrams Therapy, which uses ultrasound to help kill bacteria on the wound, and it also causes you to grow new blood vessels. It causes those wounds to actually increase the blood flow to
It's
the
really the
wounds.
problem with the diabetic foot anyway, isn't
Correct.
it?
Correct. So it's funny. I was telling you earlier, I didn't even want to do this stuff when I first got here, and 14 years later, I love healing the patients. The technology's fun, and you know what the best thing is? You really get to know your patients because you do have them for a long time, and you get to know them
Well, their
and help
disease,
educate them.
their fundamental disease isn't really going away. If you're a brittle diabetic, that's way past the borderline diabetic.
Right.
You're going to be afflicted or affected with that disease probably for the rest of your life.
Right.
It would be nice to spend the rest of your life with both your feet. My brother lost his leg from diseases, and it altered his life tremendously. And I believe it was the cause of him losing his life when he
Right.
was a year younger than I. So the technology that you bring to the table to save this foot and ankle from being thrown away from a surgery is really tremendous.
Yeah,
right?
and the technology gets better and better. The other thing we are getting into is the understanding the biomechanics of the foot. Like, why do you get a callus in one area and not another area? And that's one of the things Dr. Martin and Dr. Purvis and I will all really look at, is to make sure we have a good balance of the foot. Like you were talking about with the toe patient that you had that had the bad hammer toes. There's simple procedures that are available if we get those patients early enough.
Right.
That we can talk
Procedures
to them
that can
about.
save, again, a trip to the operating room with
right.
a little bit of numbing medicine in the
Yeah,
office, correct?
they're very simple. When you have a hammer toe and your toe is bent, you can just put some little numbing medicine there, nip the little tendon on the bottom of the toe,
Straightens
straightens
right
it right out, and you don't get a bone infection, you keep your toe, and you don't have to go to the hospital.
And you may keep your foot.
Correct.